This week we'll focus on Attention Deficit Hyperactivity Disorder, or ADHD. ADHD is not one of the disabilities recognized under IDEA, but students with ADHD can receive services under the Other Health Impaired category or through Section 504 of the Rehabilitation Act. There are neurological, hereditary, and environmental factors that influence the development of ADHD. Characteristics of ADHD include behavioral, social, emotional reactions, and they can occur comorbidly, that means alongside of, other conditions. In terms of the assessment of ADHD, professionals look at medical, behavioral, and educational evaluations when diagnosing and prescribing treatment and educational intervention. While most students with ADHD are served in the general education classroom, functional behavior assessments, self-regulation and self-monitoring, and instructional modifications along with home and school collaboration have proven to help students succeed. There is recognition that ADHD is a disability that influences individuals throughout the lifespan and impacts social and personal relationships as well as post-secondary education, employment, and career options. In this week's module, the learning objectives are listed for you here. At the conclusion of the week, you want to quiz yourself and see if you can do these things. If you can, then you're good to go. If you're struggling with some of them, then please go back and review to make sure that you can do the following. First, you should be able to define attention deficit hyperactivity disorder. You want to be able to list the possible etiological factors that are associated with ADHD. You should be able to identify learning characteristics and social-emotional issues that are typical of students who have ADHD. You want to be able to explain how ADHD is diagnosed, define multimodal intervention, outline instructional and environmental modifications typically used with students who have ADHD, describe the role of stimulant medications in treating students with ADHD, and summarize the impact of ADHD on adolescents and adults. When it comes to defining ADHD, we look to the American Psychiatric Association's definition. It's described as a persistent pattern of inattentive and/or hyperactive impulsivity that's more frequent and severe than is typically observed in individuals at a comparable level of development. What this means for students in the classroom is students with ADHD might struggle with school routines and expectations due to their tendency to appear inattentive or distractible. These students also might find that they have a hard time concentrating and complying with requests that their classmates don't. In terms of their behaviors, when we're looking at identifying these students, the behavior has to have persisted for at least 6 months and to a marked degree across 2 or more settings. Now, IDEA, the law that protects students with disabilities, doesn't have a definition of ADHD, and it's not a separate category for disability. Students who do need special education services as a result of their ADHD can receive services under the label OHI, or Other Health Impaired. Students who don't need specialized instruction but do require accommodations will receive those services under Section 504 of the Rehabilitation Act. Students with ADHD can have one of 3 subtypes: ADHD predominantly inattentive type, ADHD predominantly hyperactive impulsive type, and ADHD combined type. Students may exhibit either of those types or a combination of both, which is the most common. When it comes to prevalence, researchers estimate that 3 to 9% of the school-age population have ADHD. The diagnosis of ADHD is becoming more prevalent, and the numbers of students served under the OHI, or Other Health Impaired category, which contains the label for ADHD, has increased tremendously. The label ADHD may reflect cultural, gender differences that account for the greater number of male students who are identified as having ADHD. When it comes to etiology of ADHD, or the cause or causes of the condition, research points to 3 areas. The first is neurological dysfunction. Anatomical differences and imbalances in brain chemistry may be contributing factors for ADHD. These regions control behaviors such as self-regulation and working memory. Hereditary factors may also be a cause. Family and twin studies seem to indicate that ADHD runs in families. And finally, environmental factors. Environmental factors can include maternal drug or alcohol abuse, lead poisoning, low birth weight, or premature birth. Characteristics of students with ADHD can include the following: inattention, hyperactivity, behavioral inhibition difficulties, executive function problems, social and behavioral issues, and comorbidity of other academic and behavioral difficulties. When we assess students to determine whether or not they have ADHD, there are three components to the assessment. The first is that it's multidimensional. That means that it involves parents, teachers, physicians, and school professionals. The second is a medical evaluation. Children aged 6 to 12 are evaluated for ADHD, and they must meet the DSM-5 criteria. It requires input from various settings, and the team must consider coexisting disabilities. Finally, a behavioral or educational evaluation is conducted. Often rating scales are used to evaluate a student's behavior. We do need to be careful because there's potential for bias that exists here due to the varying perceptions of multiple assessors. When we think about educational considerations, it's important to note that students with ADHD are likely to spend most or all of their school day in the general education setting. Most students with ADHD are eligible for accommodations that will help them achieve academic and behavioral success. Tools such as the Functional Behavior Assessment, or FBA, can be conducted. These help to determine the cause and consequences of students' actions and behavior and help us to create more effective behavior intervention strategies. We can teach students self-regulation and self-monitoring skills. A homeschool collaboration is helpful. We can also engage in using instructional and multimodal interventions. And some families will choose medication as part of their program to assist students in maintaining their behavior. However, this can't be the sole means of changing behavior, and there's quite a bit of controversy surrounding the use of psychostimulants in children. We can also look at using counseling services and working with intervention specialists and general education teachers to make inclusion work using collaboration and instructional strategies. With regard to adolescents and adults with ADHD, it's important to remember that for years, professionals considered ADHD to be a childhood condition, and only recently has adult ADHD become an area of research. ADHD is a lifelong condition, and adults with ADHD often require support and self-management throughout their lives in order to achieve successful education, employment, and relationships. There are observable characteristics and consequences for adults with ADHD. Some important considerations are going to be educational and vocational outcomes, marriage and relationships, and family relationships. Through the chapter and the videos and content this week, make sure that you're really focusing on our learning objectives. And as you move forward, if you have any questions, please let me know.